Tanauan City in Batangas are positive for arsenic. Laurel, Balete, San Nicolas, mataas na Kahoy, Alitagtag, Santa Teresita, Lemery, Taal and Tanauan City. Batangas Capital Public Information Office reported that the presence of arsenic in the water wells was previously noticed after the eruption of Taal Volcano on January 12, 2020. Learn about arsenic through this webinar brought to you by PSQM Online Lecture Series. Welcome to our webinar. Please send your questions through the comment section of the video stream. Thank you, and let's enjoy the knowledge sharing today. For our welcome remarks, I would like to introduce Dr. Conrad Narcil B. Di Malaluan, our Medical Director from Daniel O. Mercado Medical Center. Good afternoon, Doc Conrad.
Hello. Good afternoon. Am I getting to you? All right. All right.
Yes, sir.
This is good. All right. Hello. Welcome, everybody. It's alarming, that Tanauan is one of the positive in high levels of arsenic, and a number of other barangay and city in Batangas. It's also positive for this. So it's really alarming. And I unfortunately, mukhang dulot to nung Taal eruption. And me, as a resident here, I'm actually from Santo Tomas. It's actually wondering, am I safe from arsenic poisoning? So it's very timely that we have this lecture, and I would really like to hear from Dr. Nerissa Dando. So I'd like to welcome everybody. Thank you for attending this webinar. I hope a lot of us will learn a lot of things from this seminar, and we'll know, and maybe we can allay our fears whether we are safe or not safe from drinking this, or what can really happen to us at the worst. So thank you very much for attending this, and I really like to welcome everybody. So enjoy the afternoon. Thank you very much. Thank you, Mike.
Thank you, Dr. Conrad. And again, good afternoon, everyone. By the way, my name is Mike Legarda, the Corporate Quality Management Manager under Corporate PSQM, and I will be your host for this afternoon. Okay. So hindi kompleto yung ating hapon kung wala tayong moderator for today's lecture, no? So I would like to introduce our moderator for today, our Associate Director for Technical Training, none other than Ms. Evangeline Ariola, also from Patient Safety and Quality Management. Good afternoon, Ma'am Vanji. The floor is yours.
Thank you, Sir Mike. Thank you, everyone. And we are very fortunate today that we have a speaker who is an expert in this field. So most of the people maybe are not aware that there is an arsenic poisoning happening in the 9 municipalities and 1 city, or 9 here in Batangas, which is an after effect of the Taal Volcano eruption. So we have experienced a lot of difficulties right after the eruption, but the pain continues. So this afternoon, I am very proud to welcome and introduce to you our speaker for this afternoon. So next slide, please, Sir Mike. So our speaker is Dr. Nerissa M. Dando, the head National Poison Management and Control Center or NPMCC of the UP-PGH. For her education, she finished her Bachelor of Science in Chemistry from the University of the Philippines, Diliman, and her Doctor of Medicine from the Pamantasan ng Lungsod ng Maynila. For her trainings, she had her internship from the Hospital ng Maynila, residency training in pediatrics from the Philippine General Hospital, fellowship in adolescent medicine, Philippine General Hospital, fellowship in clinical toxicology, National Poison Management and Control Center of the UP-PGH. Next slide, please, Sir Mike. So among her affiliations, she is the Associate Professor 7, Department of Pharmacology and Toxicology, College of Medicine, University of the Philippines, Manila, and Vice President of the Philippine Society of Clinical and Occupational Toxicology and Vice President of Philippine Society of Adolescent Medicine Specialists. So friends, Qualimed, my colleagues, doctors, everyone here in the call, let us all welcome Dr. Nerissa M. Dando, the head of National Poison Management and Control Center. Dr. Iris.
Banji, for that kind introduction. And of course, thank you for that welcome remarks, Dr. Di Malaluan. First and foremost, I would like to also thank, of course, the QualiMed Health Network and the Daniel Mercado Medical Center for inviting me. I agree, this is a very relevant and timely topic. And I think all of the Batangas residents should know about what's happening in your area. And of course, I cannot refuse the invitation of my very good friend and co-intern, the former president of PCP, Dr. Gina Nazareth. Parang hindi naman ako makakahindi sa kanya. Okay. And of course, shout out to all my BFFs na sabi manonood ngayon, Dr. Eden Castillo, mga nephro, and Dr. Giselle Santa Maria. I hope you're here, sana, or in the Facebook. And of course, to all my friends in Batangas. Yes, I think we have a very timely topic, and we have to be very concerned about the situation in arsenic levels, of course, in your area, because water is an essential thing, diba, for our life to survive. So we need safe water for all of us to be able to have a good health for everyone. So can I share my screen so that I can give at least 30-minute lecture, kung kaya kong squeeze in 30 minutes, because I think you need to know all of these things, especially the doctors who will be handling patients na baka mamaya meron na palang red flags or signals that you need to work up these patients, as well as alert the public health officials regarding incidents of arsenic poisoning. Okay, although yun nga, it's a good thing that they were able to monitor the arsenic level so that you can have already warning signals and what to watch out for in your area. So for this session, I will be discussing health effects of arsenic in the body. Although nawala na dito yung, the objectives, but I'll be giving you the outline is the sources, the possible sources of arsenic, not just after the eruption in Taal, but there are other things. There are other sources of arsenic in the environment as well as in the workplace. Di ba Batangas is an industrial place? So ang dami ding mga industries dyan that may also have possible sources of your arsenic. And so aside from the sources, I'll be discussing, of course, the specific health effects and possible treatment and interventions, and eventually prevention of arsenic poisoning. So just a little background of history of arsenic poisoning. As early as the 15th and 16th century, in Italy, for example, the family of Borgias, I'm not sure if you have heard of them, but they're very notorious using their arsenic as their favorite poison for political assassinations. Parang pinapatay nila yung mga kalaban nila sa politika at that time. Okay? So some even have suggested that Napoleon was apparently poisoned with arsenic-tainted wine served to him while in exile. And there was also reported incidents in US wherein the causative agent in an outbreak of a foodborne illness after a church gathering, which the coffee urn was apparently criminally contaminated with arsenic. So a lot of things, so parang associated na talaga yung arsenic with the word poison. And although this is an ancient poison, it has medicinal uses in the treatment of your syphilis and psoriasis before. But currently, it is used also in the treatment for pre-myelocytic leukemia, which is that causes cancer cells to differentiate and eventually undergo apoptosis. So may use naman siya. Kaya lang yun nga, mas toxic siya kesa yung mga specific medicinal uses, which should be monitored closely as well, and specific therapeutic dosing should be strictly adhered to. Okay. Now, other causes or other incidents that the natural sources of arsenic in drinking water and in coal caused massive poisonings in Bangladesh and even in China and even other countries. I will show you later. But locally, in the past, in our country, the mine spills in Marinduque, I'm not sure if you've heard of this, but in 1990s, actually hanggang ngayon, parang just a few weeks ago, eventually ngayon lang nabigyan ng mga incentives yung mga affected individuals in the region, in Marinduque. But we were there several times and we were monitoring patients who were exposed because of contaminated water after the mine spillage, which contains elevated levels of not only arsenic, but other heavy metals as well. No? So may lead, may copper, etc. Okay, not only that, in geothermal areas, so yun talagang malalapit sa bundok. Kasi nga, pag may nag-geothermal, nag-construct ng geothermal, then magkakaroon ng mga diggings and eventually magagalaw yung mga lupa. So we'll be exposing some of these arsenic in those areas. So one thing, when we also did health assessment before, parang young consultant pa lang ako, we went to Kidapawan, Cotabato together with some of my friends as well. We were doing health assessment and some of the consultants at the Poison Center. So we also did health assessment for people there as well as measure the levels of arsenic in those areas. Okay? So marami pa yan, but as I mentioned, one of the historical event that happened with contamination of arsenic, most especially in underground water supplies, occurs in the following areas. No? The largest mass poisoning that happened in the history, mass population, so in Bangladesh, almost 80 million people were affected. And even in West Bengal, India, this is described by the WHO as the largest mass poisoning. What happened is kasi, nagdig sila ng mga wells to be able to supply water to these communities. But apparently, they were not able to take the arsenic levels for these areas. And so after several years, they noted that some people are developing already arsenic poisoning manifestations. Okay, I will show you later what are these manifestations that you will be watching out for. This boy, for example, is the victim of that. And so nakita niyo putol na yung kanyang isang paa and marami siyang mga keratotic lesions. And we will be discussing some of those things later. Okay. So other areas in Chile, Argentina, Mexico, and the USA, even in China, Taiwan, and Thailand. Marami talagang mga arsenic poisoning globally, not only in this inner area. So what is an arsenic? It's actually a naturally occurring metalloid, but it's also considered a heavy metal, just like your mercury and lead. No? It is natural in the environment, so it's ubiquitous, and in elemental form, it is a gray solid material. But there are other forms, no, that exist for this arsenic. The other form that exists in the earth often is the inorganic arsenic. This inorganic arsenic is the trioxide and the CCA. In the form of your chromated copper arsenate or CCA, it was once used as a part of the treatment to render your architectural wood immune to pest infestation. So para hindi naanay. So ginagawang pesticide yung ibang arsenic. actually until now, may ginagamit sila mga pesticide with which contains your arsenic. So we have to be very careful with that. Okay? Now, when this is combined, when arsenic naman is combined with hydrogen and carbon, so parang nagkakaroon ng methyl part yung arsenic, it becomes now an organic form, which is the non-toxic form of your arsenic. Now, the fourth form is your arsine gas or the hydrogen arsenide, which is the most highly toxic form, which can be a potent hemolytic agent for patients who are exposed to it. Okay? So again, pwede siyang medicinal agent. It's a very good pigment. It's used as a pesticide, but it is used also as an agent of criminal intent, as I mentioned in the history. Okay. Now, what happens is that arsenic is released into the environment during volcanic eruption. And that's what happened in Taal. No? Ang daming ang problema when the Taal erupted, no? Not just the toxic gases that was emitted, tapos eventually all of these things are affected. Ngayon, pati yung ating water is contaminated with these chemicals. No? So there's contaminated drinking water. Now, what other sources of arsenic? These are some Ayurvedic medicines, and even some Chinese herbal medicines contain arsenic. I've mentioned already pesticides and possible herbicides and fungicides, the wood preservatives. Now, there are some ceramic enamels and paints and glues, no? Pwede ding magkaroon ng, some contain also arsenic. Even in your cigarettes or tobacco, the burning of fossil fuels, and of course, the one that I mentioned, the arsenic-laden wine that apparently was the cause of death of Napoleon Bonaparte before. So there's illicit whiskey, or what they call the moonshine wine. So it contains arsenic as well. And of course, the non-toxic form, the organic form, may be in your foodstuffs, no? Even your milk, dairy products, beef, pork, poultry, rice, and cereals. They can be all over. Kasi nga naturally occurring siya, but just in small amounts and in non-toxic form. So that's very important for us. Now, in occupation, that's why we need to know the specific chemicals that are around in your workplace. Now, if you're involved in smelting, plating industries, nako, these are, arsenic is a byproduct of the ores that contains the lead, gold, zinc, cobalt, and nickel. So pag tinanggal na itong mga metals na ito, pwedeng byproduct ng ores is your arsenic, which will eventually contaminate the air, the water, the soil, and the whole environment is contaminated. Nako, what else? The microelectronic industries. I know there's a lot of industries in Batangas, diba? Now, arsenide is used in some semiconductors, computer chips. So you have to monitor their levels in the environment with regards to this arsenic also. No? Naku, may coal power plants din, di ba, dyan sa Calaca? So you have to monitor as well. And then manufacture of glass and fireworks. Again, use of pesticides. And I've mentioned earlier, contact with wood treated with arsenic as preservatives. Now, there's a note here that organic arsenics are found in your foodstuffs. No? So, pwedeng in fish and seafood. Oh, and I mentioned these are non-toxic in organic form. Although, nakita nila some long-term exposure daw with cutting and burning of food that is preserved with the CCA that I mentioned, the copper chrome arsenate, eventually causes daw elevated blood levels, but there was no signs of symptoms naman of arsenic toxicity. So, these are still being investigated and being studied. Why is this so? Okay. Now, how are your arsenic being absorbed? Mainly by oral and inhalational routes. Okay. So, may inom, makakain, malalanghap. Yun. Although, there are studies that some amount of dermal absorption is possible through your mucous membranes. Or if there are broken skin, no? So kung may mga abrasions, may mga wounds, baka doon talaga pwede pumasok yung arsenic. And 60 to 90% of this is absorbed in your GI tract. Now, I mentioned again, initially your arsenite will be converted into your arsenate. And then, magkakaroon ng methylated, or there's a methyl group, the carbon and the hydrogen group that will link to this arsenic. it then converting it to the non-toxic organic form, the monomethyl arsenate or MMA, or the dimethyl arsenate or DMA. How is this distributed? Nako, all over. Upon ingestion, it is widely distributed to almost all tissues in the body. And upon ingestion, it also accumulates at very high levels saan? Sa hair, sa skin, sa nails. So pwede yung makita. Due to the, because of its effect, it binds to the sulfur-hydrate coat containing protein keratin. Okay? So even in breast milk of lactating mothers, natagpuan siya. So if you have high levels of arsenic, then we prevent or we advise the mothers not to breastfeed the baby temporarily. Okay. Now, kinetics, the half-life of your inorganic arsenic is the inorganic arsenic in the blood is 10 hours. So medyo mabilis lang naman yan. But the organic one is longer, so around 30 hours. Buti na lang, but this is the non-toxic one. In 2 to 4 weeks after the exposure ceases, most of the remaining arsenic in the body is found already in your keratin-rich tissues. Yun nga, in the nails, in the hair, and in the skin. So very important yung mga deposits na yan. Kasi dyan yung makikita kung nasaan yung pwede nyong kuhaan ng sample as well as the manifestations of this arsenic poisoning. Now, I mentioned already that the inorganic arsenic is converted to the organic arsenic, okay, by biomethylation to your monomethyl arsenic MMA or the dimethyl 1. So this may represent actually a process of detoxification na, di ba? It's a toxic substance, but then the body eventually, with some processes, demethylate it or biomethylation, converting it into a non-toxic form and eventually excrete it. So may protection man tayo talaga. Our body has its own protection with regards to exposure to these chemicals. However, if it is being overwhelmed already with large amount and chronic exposure, then that's the time that some of these poisoning manifestations may sets in. Okay. Now, renally excreted siya. So very important that the kidney has very good function so that we can excrete it immediately. So 50 to 80% of the inorganic arsenic excreted in about 3 days. So dapat talaga mailabas agad yan. So both forms are excreted depending yan on the acuteness of the exposure, whether it's acute nga or chronic, or the dose. So kung masyadong malaki na ma-overwhelm, then some of the arsenic poisoning manifestation may sets in. Okay. So how does it work? What is the effect? This is the pathophylogy of arsenic poisoning. So the inorganic forms, as I mentioned, are the more toxic than the organic forms. But this inorganic forms has again 2 forms, the trivalent and the pentavalent forms. The trivalent is the more toxic one because it is the one that binds to your sulfur-hydryl groups. And dito sa katawan natin, ang dami-daming may sulfur-hydryl groups na enzymatic steps. So eventually, pag nag-bind yan to these sulfur-hydryl groups, it leads to inhibition of a lot of enzymatic systems in the body, including your Krebs cycle. Remember, very important ang ating Krebs cycle in the formation of your ATPs and energy. So it affects also your oxidative phosphorylation. Less toxic ang pentavalent forms, but then again, its toxicity arise kasi eventually it will also be converted to trivalent forms in the body. But then the pentavalent forms may also resemble your inorganic phosphate and substitute for phosphate in your glycolytic processes and respiration pathways as well. So uncoupling din yung oxidative phosphorylation. Okay. Other things that I have noted, the arsenic has been shown also to produce oxidative stress, inactivate your nitric oxide synthase, and the trioxide form has been shown to cause a significant prolongation of your cardiac action potential duration, leading to a lot of cardiac manifestations, including arrhythmias, meron pang ang torsade and other very lethal manifestations for cardiac effects. Okay? And most especially for the chronic exposure, arsenic is now listed as a presumed carcinogenic substance based on the increased prevalence of lung and skin cancer observed in human populations with multiple exposures, primarily through industrial inhalation naman. No? So not only, actually ngayon, hindi na lang lungs and skin. Ang dami na, even other organ systems, pwede na siya, may liver, may kidney, okay? And all of these things are already affected. So multiple organ system effects ang mga manifestations of your arsenic poisoning. So let's look into arsenic poisoning symptoms through history taking. What is very important is you look at the arsenic exposure, usually no, kung occupational or environmental, but as I mentioned, it can also result from deliberate poisoning. Lalo ngayon, ang daming mga mental health issues. So some patients may see that these are poisonous substances and may ingest it eventually. And we had a lot of referral for that, ingesting pesticides that have arsenic-containing chemicals. So eventually may cause also arsenic poisoning symptoms. Okay. Now, exposure to arsenic gas is usually the result of industrial accidents. And so you need to take the work and travel history. When a patient presents with painful peripheral neuropathy, this is very classic, no, very specific for arsenic poisoning. Painful na peripheral neuropathy. Okay? So other history, you have to elicit exposure from hobbies, unusual forms of this alcohol or diet supplements, and even herbal medicines. Now, these are very significant and characteristic symptoms of, I will talk first about acute arsenic poisoning. If you have ingested large amount or exposed to a large amount of arsenic, one time, big time, no? The manifestation will usually start within 30 minutes to 2 hours. There's usually a garlic odor that is often present in the breath and body tissues of the patient, and they will manifest as a cholera-like severe vomiting. No? Talagang may abdominal pain, very severe, hypersalivation, and the diarrhea is usually bloody. So yun yung mga very significant, no? Cholera-like vomiting, tapos bloody diarrhea that may eventually lead to hypovolemic shock. Now, the trivalent arsenic, I mentioned, the more toxic one, can also be corrosive. So it may cause also oral burns, dysphagia, and GI bleeding for these patients. I mentioned also cardiovascular effects, so myocardial depression, dehydration, and the arrhythmia. So you have to check the ECG for changes, including ST segment changes, prolonged QT interval. No? So VTAC, you look at the torsade and ventricular fibrillation. Now, there may be also peripheral gangrenous extremities. This is what they call your Blackfoot disease. As in, nangingitim talaga yung mga paa because of these effects of acute arsenic poisoning. And for respiratory, there might be pulmonary edema, adult respiratory distress syndrome, and even acute respiratory failure. Remember that most of the, as I mentioned, majority is ingestion and inhalation. So this inhaled arsenic can cause not only irritation, but eventually bronchospasm and eventually pulmonary edema. Now for renal and hepatic, another characteristic of arsenic poisoning is the manifestation of your black water urine. Talagang nagkukulay black na yung urine because of severe hemolysis, no? So there's hematuria or hemoglobinuria, and eventually there will be also proteinuria, ATN, and acute kidney injury. So aside from that renal manifestation, hepatotoxicity as well. So this patient may also present with jaundice, hepatomegaly, and pancreatitis. What we don't want also to happen to our patient are neurologic symptoms like seizures, no? And then eventually going into CNS depression, encephalopathy, and coma. But as I mentioned earlier, there's hemolysis, so hematological, there's also bone marrow suppression, and you can see in the peripheral blood smear basophilic stippling and rouleau formation in your blood film. Although for acute arsenic poisoning, the skin manifestation may only be some forms of rashes. No? Wala pa yung mga keratotic na we'll be telling you later with regards to chronic poisoning. So rashes lang. But then this one. Now we look at the chronic arsenic poisoning symptoms. Very, very typical and very significant and characteristic for chronic arsenic poisoning is the manifestation in the skin. This is the most common effect of chronic exposure, but it usually starts about 10 years after the first exposure. Although, yung iba, as early as 7 years daw. No? Although, depending on I'm sure it depends on the dose and the chronicity of the exposure and the condition of the patient themselves. So, matagal, pero some can be very fast depending on certain factors. So, what are these manifestations? Ayan, I'm sure nakikita nyo, very graphic, no? Yung pictures. You can see keratosis, very typical on the palms and soles. No, these are classic dewdrops on a dusty road appearance. Ketotic nga yung tawag namin. So we've seen this in some of our patients before. Talagang may itim siya na parang lugo pero dusty ang appearance niyan. So there's also hyperpigmentation, especially on the arms and upper chest with diffuse dark areas or raindrop pigmentation. So although some reported also a mixture of hyperpigmentation and hypopigmentation in some patients, but they can see exfoliative dermatitis, and some also manifest with alopecia, conjunctivitis, and corneal ulceration. So you have to look for all of this in your patients who are exposed to arsenic. And most importantly, although parang minsan na taken for granted, are the mist lines. You have to look in the fingernails, no? These are transverse white lines on nails. You see this in this picture. Ayan. So these are mist lines. These are opaque horizontal lines that correlate with the periodic increase in arsenic exposure. But these are non-specific. We also see this in some of our heavy metal poisoning cases, like in lead and even in mercury. Although mas characteristic daw siya sa arsenic. But it also may result from other conditions like Hodgkin's lymphoma, carcinoid tumors, and even during chemotherapy with cyclophosphamide, vincristine, and doxorubicin. That's why in your history taking, you should be considering these possible exposures and other chemicals that may have been given to our patient. Okay, what else? Of course, there's also still with GI manifestation, but these are more on weight loss. No, abdominal pain na hindi maalis-alis, and of course, anorexia and on and off diarrhea in some patients. But mas kita dito yung jaundice, hepatomegaly, and the development of the portal fibrosis and cirrhosis. Also in cardiac and respiratory, instead of the arrhythmias, the coronary heart disease, no, especially for those smokers, myocarditis, pericarditis, hypertension, peripheral arterial disease, restrictive or obstructive lung disease. And in children, these are seen earlier, no? An average of 7 years of exposure. Hindi ko na nasama dito, but there were also studies that there are developmental effects. Yung cognition of children exposed to high levels of arsenic or chronic exposure to arsenic can also be affected with this arsenic poison. Okay. So hema, pancytopenia, aplastic anemia. And for neurological, now this is the difference from the acute and the chronic. No? For the chronic, dito nakikita yung peripheral neuropathy. Yan yung may painful peripheral neuropathy. So there's sensory and motor affected a few weeks after exposure. So painful paresthesia that is symmetrical and very characteristic, stocking glove in distribution. Okay. And now they have seen that the motor weakness and ascending paralysis are almost the same to your Guillain-Barré syndrome that may eventually develop with chronic exposure to arsenic poisoning. And then muscle fasciculation and wasting and even ataxia. Now, very significant that if you have comorbidities, apparently it may increase the risk of developing or aggravating your condition, like for diabetes. And of course, we're all very afraid of the increased risk of cancers. No, not just because the skin manifestations may eventually lead to other cancer of other organ systems. So hindi lang skin cancer like basal cell carcinoma and squamous cell carcinoma of the skin, but can also involve other organ systems like the lung, the blood, the kidney, and possibly the liver, the lymphoid, laryngeal, and other organ system as well. So now, how do we diagnose? Let's go first to acute arsenic poisoning. Of course, the basic laboratories in your CBC and biochem, no? Lalo na yung liver function, kidney function, electrolytes, including the calcium and magnesium. Okay, ABGs, urinalysis, your ECG. And then, of course, you can request for arsenic levels, both in the blood and in the urine. Okay. Chest X-ray and plain abdominal X-ray you may see inorganic arsenic compounds because they can be presented as a radiopaque in your X-rays. Okay. Now, for arsenic levels, the serum arsenic level can be done if there's within the first several hours post-exposure, and it should not exceed 5 micrograms per liter. For the 24-hour urine, so you have to collect 24-hour urine sample, no? If within 1 to 3 days exposure, and this should be speciated. Remember, I was telling you earlier, there's organic and the inorganic fractions. I'm sorry, mukhang nagkamali dito. But you should take into account the total arsenic should be less than 50. Tama ba yan? Okay. So you have to look at the speciation. Dapat konti lang yung inorganic levels because these are the toxic ones. Okay. And I mentioned since they are deposited in the hair and in the fingernails, so some of them can be samples can be samples can be taken from the hair and the fingernails, and it should be less than 1 microgram per gram. Okay. Now, for chronic arsenic poisoning, the same basic laboratories, but this time you just need the urinary concentrations. Hair samples can be beneficial, and your arsenic levels should be determined, especially your drinking waters. So this high level of arsenic in water should be correlated in conjunction with relevant clinical features that are useful for the diagnosis in some settings of your arsenic poisoning. And investigation, of course, and screening for complications may be appropriate. As I mentioned, look for diabetes, hypertension, cardiac problems, etc. Now, what is the regulatory or the accepted arsenic levels in your drinking water? According to the World Health Organization, okay, the US EPA, Environmental Protection Agency, the current drinking water standard or the maximum contaminant level for arsenic is 0.01 milligram per liter or parts per million. So this is equivalent to 10 micrograms per liter or 10 parts per billion. Okay. So now for chronic poisoning, the serum arsenic level done and should not exceed this time 3 to 5 microgram per liter, although some centers or even in other countries preferred nila yung urine na lang. So they have 24-hour urine arsenic level again speciated into the organic and the inorganic fractions. It should be less than 50 microgram per liter as well, just like in acute. And this time, yes, I mentioned the hair again and the fingernail level should be less than 1 microgram per gram of the sample. Now, in some areas like this one, they published in Bangladesh and India, they have this criteria for the diagnosis of arsenicosis. Just by looking at the history and taking the arsenic contaminated values of 50 microgram per liter for more than 6 months of their water sources, and then the presence of the characteristic skin manifestations of this chronic arsenic toxicity, yung hyperpigmentation, the keratosis that we have shown, or even the hyperpigmentation, the characteristic of arsenic poisoning, then they diagnose already these patients with arsenicosis. So how do we manage for acute arsenic poisoning? Of course, removal of the patient from the source. If there's skin contamination, wash with copious water, seal contaminated clothing, of course, the ABCs of life. Doing gastric lavage, consider if there's significant amount has been ingested at least a few hours previously and the patient has not vomited yet. A plain X-ray indicates arsenic that is present in the stomach, and then this arsenic is absorbed primarily from the small and large intestines and rarely from the stomach. Then you can do gastric lavage. Okay. Now, activated charcoal has been given before, pero controversial pa rin siya, and there's some centers that recommend and some do not. So it depends on the situation. Okay. The whole bowel irrigation with PEG or polyethylene glycol may be used to prevent arsenic absorption. And of course, some patients or some studies have shown that surgical and endoscopic removal of this arsenic has been used successfully. So other supportive treatment, of course, you can give oxygen, bronchodilators, especially for those with respiratory problems, like your pulmonary edema, so IV fluids for hypovolemia, blood transfusion, kung bleeding na talaga actively yung patients, inotropes for your myocardial depression. If there's already torsade and fibrillation, then you can give this pacing or isoprenaline or magnesium sulfate, treat seizures with your anticonvulsants, and of course, analgesia. For those with renal impairment already, then you can do alkalinization of the urine using your sodium bicarbonate over 2 hours and repeat if necessary, and hemodialysis. Although hemodialysis does not reduce the arsenic concentration, but it may be needed already, especially if the patient already have kidney injury. Kasi hindi niya malalabas. How would we excrete and remove the arsenic in the body if the kidney function is already impaired? So sometimes you already have you need to do hemodialysis. And of course, the other toxins in the body that may not be removed because of the acute kidney injury. Okay, bone marrow suppression. So red cell and or platelet transfusion, treat the burns traditionally or conventionally. And for eye contact, then treat as a chemical eye burn. Now, chelation, there are chelators. These are the agents, no? Dimercaprol or the BAL, the British anti-Lewisite, the Succimer or DMSA, the DMPS, and of course, what we have in the country locally is your N-acetylpenicillamine. We have that. Yung Succimer, I'm not sure if it's still available in St. Luke's, no? But it's very, very expensive. Your NAPA, yung N-acetylpenicillamine lang usually what we give in Philippine General Hospital and in regional hospitals of the Department of Health. Now, consider chelation if the patient is severely symptomatic after a confirmation of an acute ingestion, or if you have symptomatic patients already with urinary arsenic levels greater than 50 microgram per liter, or asymptomatic patient pero ang taas ng level, no? More than 200 micrograms per liter already. Okay. For chronic arsenic poisoning, these are also controversial with regards to the use of chelation. Some countries, parang hindi na sila masyadong nagkikilate if it's a chronic arsenic poisoning kasi sabi nila, if the patient will eventually be exposed again, so bakit ka pa magbibigay? But if there's a way that you can remove the patient from the source and eventually, kung talagang super high, then some journals naman and some studies may consider chelation therapy as follows. So again, kung symptomatic patients with urinary greater than 50 microgram per liter, and then asymptomatic patients with a urinary arsenic greater than 200 micrograms per liter. So these are the same agents that I have mentioned earlier. And then eventually, of course, you provide arsenic-free drinking water to reduce the exposure and prevent disease developing from this exposure. Okay, micronutrients. So pwede naman mga supplements and vitamins and even antioxidants may be beneficial, especially in your undernourished populations. And apparently, certain plants compounds may help to reduce the arsenic confusions. Although we're still looking into it and some evidences are still necessary to justify its use. Okay. Now, for skincare, so mostly supportive yan. So, of course, you want to prevent bacterial or fungal infection. Now, screen and treat for complications. And of course, parang may contact tracing din to. So for other household members, check the other members if they are also being exposed. Yung pala, lahat kayo may skin lesions na. And of course, the pregnancy and breastfeeding. So I'd mentioned if it can be transferred to the babies, better to avoid or temporarily discontinue breastfeeding your babies. The prognosis now varies with the amount and rate of arsenic ingestion. The effects and complications can occur at different time after exposure. Pwedeng from days to years later, can still manifest. So talagang you need to monitor closely if you think you have been exposed to levels of arsenic, whether low or high. Kasi kung low, kung chronic exposure naman, then pwede pa rin may windows of opportunity, 'di ba? Lalo na for children. Very dangerous to expose to different chemicals. Okay? So and of course, after treatment, you still perform a careful neurological evaluation in your follow-up because the peripheral neuropathy, as I mentioned earlier, the painful one, may develop after an acute exposure and may not appear initially 2 to 3 weeks. So how do we prevent your arsenic poisoning? Test all groundwater sources of drinking water as much as possible. Okay? And not only in water, conduct regular monitoring activities for arsenic in the air, water, and even in food sources if there's a significant arsenic exposure, no? And inform the community about this hazard. And provision, of course, for your safe and uncontaminated water for. And I've mentioned the WHO guidelines, yun nga, dapat less than 10 micrograms per liter of arsenic in your drinking water. So as low as possible, dapat nga wala, but we cannot avoid that. It's naturally occurring. And the phytoremediation, although I just seen some journals, some plants daw have been suggested. The Chinese fern, I'm not sure about, hindi ko na check to, but you can check, apparently have the ability to remove arsenic from the environment. And in Bangladesh, they were, as a source, other sources of water, they harvested rainwater as an alternative source. Kasi maulan din sa kanila, no? Parang sa atin. However, yun nga, it is not without risk of bacterial contamination. And so in the workplace, proper PPE must be worn when handling or exposed to these chemicals. So regular monitoring pa rin. So urinary levels is recommended. And most especially, this arsenic-containing compounds and chemicals should not be present inside our home as much as possible. Okay, so this is my last slide. If you need to refer or ask questions regarding arsenic and other poisons, you can call our hotline number at the National Poison Management and Control Center with the following contact details. Okay, these are my references, and thank you for your attention.
Thank you very much, Dr. Dando, for that very comprehensive and informative lecture. So since we don't have any questions from the chat box, you may unmute your microphone and ask directly your questions to Dr. Iris. But I will start the questions. So how often does the testing be done to know for groundwater sources if they are contaminated with arsenic?
Ako, that's the question for Department of Health, no? Kasi DOH is the one that usually monitors the levels of different chemicals in the water. Not only in groundwater, but also, di ba ngayon ang dami ng mga, ang tawag dito, yung mga nasa mineral water, diba? Yes. So they monitor it also regularly. I'm not very familiar how frequent, but eventually, lalo na yan, if there's any significant changes like weather changes like the volcanic eruption, then they should be monitored regularly. Kasi there will be time naman, it will not be forever naman, di ba, Vanji? Kasi yung water na kapag may mga bagyo and all of this
Nawawash.
rainfall, mawawash off din sila. So, madadilute din sila eventually, mapupunta in larger bodies of water, mapupunta sa sea, and eventually mawawash off din. That's why it depends on the weather system of the area. Kung maraming rainfall, better yun kasi mawawash off sila, di ba, eventually. So, it depends on the assessment of the team of the Department of Health, how regular this monitoring system should be. Pero kung high levels yan, they really suggest that more frequent monitoring of the levels should be done. Para at least naman, di ba, kung tumataas pa rin, then the community can be alerted not to really consume or use this water. Or kung safe na, then pwedeng unti-unti, then they can go back and use safely the water in those areas. So, naman yun na wala tayong ibang sources of water considering those area, yun talaga yung kanilang main source of water.
So, yun. Thank you, Dr. Iris. So, parang good news. It's been a good news for us na nawawash out
Pero
yung...
pray tayo talaga mawash off siya.
We can observe like these past few weeks that the rains
Ulan ba dyan? Oo.
pouring. Opo, at saka sobrang lakas. Talagang sobrang lakas, parang bagyo. So, it might be a good thing for all of us here in Batangas na pwede siyang i-wash out ng mga...
Oo nga. Parang yun yung silver lining, no, Banji?
Yes. So, yun.
Hopefully. Pero dapat monitoring pa rin talaga siya.
So, yun. Ayun lang. Medyo kasi naging concerned ako because I'm living in Talisay. So it's between Tanauan which is contaminated and Laurel. So
yes.
I said
I'm sure I'm sure naman the DOH is very concerned also. That's why I'm sure they're monitoring closely. Kasi syempre the community is affected as well. Tapos yan yung main source of water natin. So we have to be vigilantly monitoring the levels of these chemicals, especially arsenic, in your areas. Hindi naman natin kasalanan kasi pumutok yung vulkan, diba? So talagang biglang nag-open siya lahat. So
we really have to
correct.
Yan, experience all the after effects of the eruption. And yung succeeding eruptions, nag-erupt siya from time.
Yun nga, right. So dapat talaga after that may mga monitoring.
Opo, may nilalabas pa rin siyang mga
advisories
materials at saka materials that may contain arsenic and other
chemicals.
Oh,
I remember nung unang pumutok yan, 'di ba, yung toxic gas and ashes yung ating concern, no? So buti ngayon na nakita that you have to monitor also the arsenic levels in those areas.
There's a question here. May vitamins po ba na pwedeng inumin ang mga bata na na-expose to arsenic?
Wala namang specific, basta multivitamins, we need that. Of course, the iron, remember, di ba nag-anemia yung effect sa kanya, potent hemolymph, although sa arsine gas yun. But still, you need iron supplements and the vitamin C as an antioxidant. So, and the B complex, of course, for the neuropathy. So, those are very good supplements for our children. Not only for children, siguro kahit tayong matatanda, mag-multivitamins na rin for our own protection. Although, the best thing pa rin is talagang prevent exposure.
Opo. Kaso, minsan hindi natin malalaman. Sabi nga, arsenic, kung your drinking water is contaminated, arsenic is odorless and colorless. So, unless hindi natin malalaman talaga. Unless I was looking at my fingernails kung may...
Tingnan mo na ba yung mist line? Lagi yan. When we examine patient yan, titingnan namin yan, mist line.
Opo. Tapos,
saka yung skin niya.
Doc, yung arsenic ba mawawala if we boil the water?
Very good question. Apparently, hindi. Kasi heavy metal siya, di ba? Parang hindi siya yung, ang tawag doon, yung hindi siya nawawala, hindi siya nagdi-disintegrate. It remains as like the mercury and the lead, it remains as a heavy metal. So nandun pa rin siya. Yung mga, for boiling kasi, naalis mo lang syempre yung mga bacteria, microorganisms, ganyan. But these are persistent kasi, so very difficult to remove. So the only thing is yung monitor and sana ma-filter. I'm not sure about the filtration part, but I'm sure there are a lot of things that we need to also to ask with regards to the filtration process, kung paano ginagawa in the water system natin, no? And also for the Department of Health.
Opo. May follow-up question, Doc. Anong blood test daw po to check arsenic sa body?
Ayun, yung blood arsenic level, meron siya, pwede. So for biological fluids, pwede kang kumuha nun.
Opo. So,
or blood arsenic level.
opo, yun namang sa akin, kasi most of the time, kasi we have parang for every corner, in some places, there are water stations. So, nawawala po ba o natatanggal yung arsenic with purified water?
Parang hindi kasi same source din siya from the groundwater. Ang naalis lang with the filtration are the microorganisms siguro and the other larger chemicals or substances, but I'm not sure about the arsenic. We'll check into it also. Parang wala akong nakita eh.
Opo. What about reverse osmosis, Doc?
I'm not very sure about the reverse osmosis as well.
Opo. So, what will be the recommendation right now kung those who are living in places who are which are contaminated with arsenic, which the DO is like announced.
So, sa nila, no?
Opo. Do we like purchase bottled water from the sources, not from
yes, actually parang yun yung I think that's one of the recommendation, diba? At least for drinking water, might as well procure or the local government or the should provide uncontaminated water or safe water for the areas. For other things naman, like pwede naman sigurong panglaba o panglinis, pwede pa naman yun. No? But the most important thing is the drinking water should be more safe. So siguro naman, those, hopefully, those with na-refill, hopefully, have good sources, no, na kahit malayo, siguro mas okay na yun rather than using the groundwater na nandyan. Although most of us naman nasa refilling station na gumagamit ng drinking water, eh, di ba? Kasi ang nakita yata nila, I think, yung mga nasa groundwater, right? Yung mga nasa well, yun yung mga kinuhaan nila ng sample. So, ang maganda talaga niyan, hopefully, they will also have their own test for refilling stations. At least, no, may na walang arsenic levels ng mga drinking waters in the refilling stations, no? Para it's safer pa rin to use.
Opo, Doc. Paano po yung ginagamit para sa pagluluto? Kasi i-ingest mo din yun. Kung hindi siya nawawala.
So hindi rin. Dapat kasama yun.
Yun din po yung Sabi ko nga sa husband ko, so let's refill our water muna. Lagay na. Kasi mataas yun. So, kami ng other sources for refilling. Kasi I'm not so sure. Talisay kasi is lower than Tanauan and lower than Laurel. So, before we know, if we might be...
Nagra-run, no?
Opo. Although hindi kami included in the initial listing of places na contaminated with arsenic. It might be. I have doubts about it. So, kaya, siguro... Yun po, for cooking and drinking, kuha kami sa ibang sources outside of Batangas.
Pagtsagaan nyo muna in the meantime. Hopefully, mag-run off na siya and ma-wash off, no?
Opo, thank you sa sa recommendations and thank you for being here today kasi maraming natututuhan sa amin. Pero kung yon, like basta siguro we should look into the anong tawag dyan, yung labels ng even our bottled waters kung saan yung
Yung
sources
sources, no?
saan
Right,
manufactured
right. Agree,
para
agree.
outside of Batangas.
Mm, mm,
So,
mm.
yun. Pwede din naman kasi sabi nyo nga industrial. So, baka not only the eruption kasi industrial sources and then kung ginagamit siya sa agricultural
Correct. Mga pesticides.
pwede din. So, paano yun? At saka kung groundwater yung ginagamit din po sa irrigation ng mga pagkain. So, maybe yung mga hindi na niluluto like yung mga
Oo,
salad
naku.
mo, dapat hindi din kami kumukuha.
Oo nga, careful na lang kayo. Although kasi it can be diluted, but then again, you can never tell, di ba, how much yung nandoon. That's why, ano na yan parang domino effect that everyone is affected because water is an essential chemical for us or essential for life. So gamit natin lahat yan. So we have to be monitoring and eventually looking at the effect of this in other environmental system natin. So even tama ka, even in agriculture, paano nga naman yung ano doon, 'di ba? Pang didilig. Although mostly rainwater naman. So sana nga yung rainwater madami ma-wash off niya.
Kumukuha sa mga deep well o sa well na
yun na lang, yun yung medyo delikado kasi yung mga deep well kasi nandun sila nag-accumulate eventually, di ba? Unless ma-run off sila eventually. Pero dun sila initially mag-accumulate. Kaya lumalaki tuloy yung level kasi dun sila nagsistay, tumataas. Unlike in running water siguro, madadilute siya, mapupunta siya sa iba, tapos may tributary, so eventually maliless concentrate sila, di ba? So
mas
ganun yung
maganda kumuha sa mga falls. Ngayon,
oo nga, tama ka.
Sana yun yung
running siya.
Tapos, so may question pa po, pero I think hindi si Dr. Iris ang sasagot nito. Pakimention po kung meron tayo sa DMMC ng arsenic test. Is somebody on the call?
Oo nga, meron ba sa inyo?
Kasi ano naman po, parang I would think we do not have any, pero we'll just check po kung meron. So, with our laboratory. Kasi ito naman yung parang hindi laging tinitest. Although ngayon, contaminated ang Batangas, pero because of the ano naman ito, yung low demand for the arsenic test.
Exactly. Kahit in Philippine General Hospital, wala kami. We also send out to other big centers. So may reference lab yung DOH, although I'm not sure if they have arsenic, but I think I also asked yung mga team dyan I think kahit before us, we send it to some private laboratories like yung Kempro, yung may arsenic sila, or they told me na merong arsenator daw dyan sa Batangas Regional yata that they can check for the levels of the arsenic.
That's good. Siguro doon po nag-test ang DOH namin. So, Kempro and Batangas Medical Center.
Kempro kasi dito I'm not sure if they have branches in Batangas.
Kempro. So, ayan. I stand corrected. Sabi ko kasi Kempro. So, it's Carepro.
Okay. Dito in Manila kasi, yung Kempro. Yung pinadadala namin.
Kempro.
Sa Mandaluyong, yan, sa bandang Pasig. Yan. Doon kami nagpapadala ng for the levels also. Yan.
Yeah, now we know na. Ito pa rin po another question. Hi, Doc. Just curious if there's a chance to get arsenic in the system through open wounds.
Oo. Yeah, I mentioned that before. Although less ang dermal absorption, but then again, yun nga, if there's abrasion or open wounds, kasi pwede siyang pumasok daw sa mga mucous membranes also. So, yun yung danger. Kaya huwag kang mag-wade ng, kunyari for example, kung may mga sugat-sugat ka sa paa, baka pumasok din.
Opo. So ano din, wag maligo dun sa ano, sa
Oo, yun, wag maligo.
well or sa
Or kung
groundwater source.
gagamit, kung maglalaba ka, nagagamitin mo yon pero may sugat ka sa kamay, di ba, baka pumasok. So, mag-gloves ka na lang para sure.
So, yung pa rin, Doc, kasi syempre, no, this is something important. You mentioned that arsenic can pass through the placental barrier. So, pwede po bang mag-cause ng miscarriage or abnormalities in fetus?
Actually, hindi ko na ano yan, but there are reported cases apparently ng mga miscarriages. Hindi ko na lang nakita yung reproductive. Although, still investigation, pero may mga reported cases.
Ayun po. Thank you, Doc. I think there are no more questions. So at this point, we would like thank you very much, Dr. Iris, for being with us this afternoon, and would like to present our certificate of appreciation. Let me read it. Qualimed Health Network presents the Certificate of Appreciation to Dr. Nerissa M. Dando for her expertise and valuable role as speaker during the webinar entitled Hair Effects of Arsenic in the Body, given this 24th day of June 2022 by a Zoom virtual event. Signed by Maria Gina C. Nazareth, MD, Vice President for Medical Affairs and Qualimed Health Network, Ms. Margaret A. Bengson, Group Chief Operating Officer, Qualimed Health Network, and Mr. Jaime E. Ismael, President and Chief Executive Officer, Qualimed Health Network. Thank you, Dr. Iris. And I think Doc Gina is on the call. Thank you, Dr. Gina, for making this possible at nabawasan ang aming fears.
Thank you,
Thank
Iris.
you also. Thank you, Gina. Thank you also for inviting me. Okay.
Thank you, Doc Iris. I will turn over the floor to Sir Mike.
Thank you, Dr. Iris, for that very informative lecture. So for the closing remarks, to wrap things up, I would like to introduce our Assistant Director for Ancillary Services from the Daniel Mercado Medical Center. Ladies and gentlemen, let's all welcome Mr. Jonald Lazaro. Sir, the floor is yours.
Thank you, Mike. Well, Dr. Iris, thank you very much for a very interesting session. And for the people that attended, thank you everyone for spending your time attending this very timely webinar regarding the arsenic. It's very interesting to know that this kind of heavy metal can be very toxic to our body. And my key takeaway is very simple. It can trigger diabetes and cancer, and the best diagnosis here is from the laboratory and X-ray. So surprisingly, we should know this kasi parang dito nangyari sa atin. So it is good to know and to understand how can we treat it and how can we get it. So yeah. So thank you very much again, people, for attending this session. Back to you, Sir Mike.
Sir Mike, wala kang sound.
Wala na si Mike. Well, anyway, thank you very much, everyone, for attending. Thank you, Iris. And thank you. Happy weekend to everyone. Bye.
Thank you, everyone. Bye, Dr. Iris. Thank you, Doc Gina, and everyone here. Thank you.
Thank you, everyone. Bye.